Doctor, how safe are root canals? We hear a lot about those and the potential dangers with them. What's your experience?
My personal experience is shown me that for the population of patients that I see or that find me, they're generally pretty immunocompromised and they are not handling their root canals well. All root canals remain laden with bacteria and toxins. You cannot disinfect a root canal. They say the word sterilize, but they're not taking that tooth out, putting it in an autoclave, and then putting it back in, hence sterile. The root canal procedure itself is taking out the main chamber and either putting ozone to disinfect or some other kind of medicament. In traditional dentistry, it's household bleach is what they use to disinfect. And then they fill it with a material. Biological dentists will put in biocalyx, I believe is what they're using now. But I mean, I looked and researched that has antifreeze in it or something. It wasn't nice either. So, I mean, that's why, I mean, I love the term pick your poisons because, you know, you do the best you can with the knowledge that you have, and when you know better, you can do better. So this is what we know right now. We're in kindergarten with all of this. We do know the teeth remain toxic. So the biological dentists are touting, you know, going in every couple of months and getting ozone shots to keep the bacteria at bay. So did they really disinfect the tooth or not if they're then requiring you to go in every, to monitor and get these injections? My personal belief is since you cannot sterilize them, you cannot disinfect them, they do harbor bacteria, it's 100% of the time. They're giving off these toxins. You have to, as the patient, decide what's it worth to you. Because from my mentor, who I, not just in writing because I didn't meet him personally, Dr. Price, you know, his philosophy was that, well, you know, you have to look at, that's a functioning tooth. So you take the teeth out, then the person can't eat as well, maybe. And so the function of the tooth is lost. So therefore, that might be detrimental to the body as well. So you have to weigh what's in the best interest of the patient. Joe Mercola just put out, you know, 97% of all cancer have one thing in common. They all have root canal. So the findings are showing that root canals are linked heavily to cancers. And so it's just a burden. It's another straw on the camel's back. And I think that the patient, once again, has to do their research. They're the ones that are going to lose their teeth. They're the ones that have to do the research and be willing to part with that in the interest of their health. I personally had 4 of mine extracted, including my front teeth, which it took me a couple of years to come to that, you know. As I was learning and what I was seeing was happening, people turning around after their root canals were removed, and I mean, what I was seeing was just incredible. I mean, it was miraculous, and I thought, well, I'm feeling pretty doggone good. I don't think I want to wait until I'm not feeling good to get them out. So I went ahead and had mine removed. And then there's a proper way to remove them. And herein lies the traditional biological and holistic approach once again. You know, if you have the luxury of time, and by that I mean somebody's presenting without a life sentence of 6 months to live or a year or whatever, you have the luxury of time, you want to address the immune system. Once again, everything is, you know, starting with the nutrition, lifestyles, you got to go through all of these things. I'm a psychologist, as I said, so we got to look at the emotional, you know, things. People come in, you know, they've been told they're crazy their whole life. Well, so was I. So you got to get over that. You know, you got to bless them, forgive them. Someone gave you a sentence of 6 months to live, you know, are you going to buy into that or not? I mean, who made them God? If you think cancer's a killer, well, we got to change that if we're going to, you know, if you're going to have anybody help you get to the other side, you know. So it's a lot has to do with the mindset, and there's a lot of tools that we use to do that. So given the root canals are bad, I think overall, you can't clean them. We're the only branch of medicine that leaves a dead piece in the body and expects the body not to retaliate. You wouldn't leave a gangrenous appendix in. But once again, though, the body alerts you that you have a gangrenous appendix. The one thing that's been perplexing to us is how the body doesn't have a fever. I mean, it's just dealing with this, you know. I still don't get it. I still don't understand why the body's not retaliating. When I see a root canal abscessed, like failing root canal, I'm like, hallelujah, you know, because the body's like, get out, you know. I'm like, don't you understand? This is a great thing, you know. It shouldn't be in there in the first place. Your body doesn't want it there, you know, wanting to get rid of it. So that to me is a blessing, but that's a rarity. What you usually see is when you take them out, a nice little, like, grape pocket, you know, like a grapes, you know, like all these little cyst pockets. You can't see them on the X-ray. It's really fascinating. Most of the time, you can't see them on the X-ray, but you can tell by palpation that there's pain. Pain on palpation is indicative of an infection. So you can tell that they have pain on the tooth. And then it's not until I send it for biopsy that I actually see that, oh yeah, it was infected, you know. So, but pain on palpation is usually indicative of an infection going on, whether it's visible on the X-ray or not.